In 2020, two friends decided to get tested for COVID-19 before going on a camping trip. Both did drive-through tests at an Austin, Texas medical facility. The test came back with the same result: negative. But the bills that came back could not have been more different. One was charged $199 and the other was charged $6,408. How does that happen? This one incident is just the tip of the iceberg. Hospitals have a reputation of hiding prices from patients only to surprise them with excessive bills. Over 50% of Americans have received, or know someone who has received, an unexpected overpriced medical bill. Patients should have the ability to look at prices and choose what service is best for them. So why hasn't anything been done? New laws have been passed, but hospitals are ignoring them. In 2021, Texas unanimously passed and signed into law new rules requiring hospitals to post their prices online. That was a great first step, but the majority of hospitals are still not complying, and when they are, it's not useful. Take a look at this website. Rather than seeing a package price for a procedure, websites like this are riddled with codes for each individual component. This makes it almost impossible to figure out what an in-charge will be for any medical service. Hospital pricing should be clear and useful for patients. Places like the Surgery Center of Oklahoma have easy-to-understand pricing bundles. This demonstrates it is possible to have transparent pricing that the average person can understand. This is not a partisan issue. Price transparency legislation is routinely a bipartisan effort. As for the general public, 9 out of 10 people believe all prices in healthcare should be disclosed. So how do we make this happen? The new Texas legislative session has started, and a bill has been filed that would put some teeth into price transparency legislation. Here's how it works. First, it would require hospitals to provide an estimate within 24 hours for patients who request one. Second, unless there's a complication or change in diagnosis, the final bill cannot be more than 5% of the original estimate. Third, if a hospital refuses to provide an estimate, it cannot collect the portion owed by the patient, it cannot report the patient to the credit bureau, and it cannot send the patient to collections or sue them. This means that hospitals have real monetary incentive to give meaningful price disclosures. We all deserve to be able to shop for the best medical care possible. Price transparency makes this a reality. Learn more about price transparency and other healthcare initiatives at texaspolicy.com. We'll see you next time.